I'm Dr. Sreekanth Shetty, Director and Head of Cardiology at Sakra World Hospital. Angioplasty has evolved over the last several decades and has become a very important tool to treat patients with advanced coronary artery disease, particularly those who present with heart attacks. Angioplasty started for the first time when Andreas Grunzig did a balloon angioplasty in a patient who was undergoing a bypass surgery almost 40 years ago. From there, angioplasty has evolved into a very convenient and comfortable and effective mechanism for treatment of coronary artery disease. It is most effective in the treatment of heart attacks because in this situation, no other treatment, whether it is thrombolytic agents or bypass surgery, would be as effective as or safe as an angioplasty. In angioplasty, we access the heart's arteries most commonly through either the artery at the wrist, which is called the radial artery, or we could use the artery of the left wrist, also the left radial artery, and less commonly through the femoral artery, that's the artery at the groin. With the advent of utilization of the radial artery for angioplasty, the procedure has become more comfortable for patients with less bleeding risk. Complex angioplasties like angioplasties in a heart attack or treatment of what we call left main disease, bifurcation or calcified arteries can also be now achieved through the radial artery. Complex and advanced techniques are necessary for treatment of procedures which involve treatment of chronically occluded arteries, what we call CTOs, calcified arteries where we use special techniques like rotablation, orbital atherectomy, shockwave balloon to break the calcium before deploying the stent. More recent advances in angioplasty include use of what are called drug-coated balloons, which allow us to do angioplasty without leaving behind metal in the coronary arteries. So while stents are very useful and essential in the treatment of coronary blockages, there are situations where we can treat with drug-coated balloons without leaving behind a stent, what we call metal-free angioplasty. Angioplasty outside of the heart attack situation is also used in patients who have lifestyle-limiting angina, which is chest discomfort on exertion, particularly if they have critical blockages where the chest pain is not resolved despite anti-anginal medication. Angioplasty involves a very short hospital stay, does not require general anesthesia, it has predictable outcomes, complications are manageable, and therefore when it is utilized in the appropriate patient and done in a very methodical and planned fashion, it delivers great care to patients with coronary artery disease. Thank you.